tax dollars, should Planned Parenthood receive federal funds?
No, absolutely not. I voted to keep Planned Parenthood. Planned Parenthood, let me be clear, Planned Parenthood has not received any funding for abortion. That is not something we do. That actually is, in terms of, there is an issue on the state level in terms of recognizing Planned Parenthood, but Planned Parenthood, there's no line for Planned Parenthood in the federal budget. There are services, other services that, quite frankly, that Planned Parenthood provides, and I recognize that. But I also know that there are a tremendous amount of providers out there, many faith-based providers, that would serve the needs of every woman, every child, and every unborn child without putting them at risk. And so I think it's incredibly important that we have access to good healthcare services in all of our communities. That's why I've worked with the federally qualified health centers, which are wonderful organizations. They actually provide services on a sliding scale. Many of them have moved towards providing dental services as well. And I will tell you that dental is probably the most, the least accessible healthcare service that's out there. And the sad part is your dental health is tied directly to heart disease and diabetes and infection. And having access to good dental services is incredibly important. But I would not support and do not support any type of federal funding for Planned Parenthood. Thank you.
Well, I'm appreciative of the fact that Mr. Thompson made clear that tax dollars do not pay for abortion services, period. They don't. So while Planned Parenthood might provide a service that people don't agree with, in fact, federal tax dollars have never been used to pay for those services. That is raised through separate independent fundraising efforts. So we went through hours of hearings and I watched every moment of it. That is clear. There also, again, thank you, Mr. Thompson, for making sure that people understand, there isn't a line item in the federal budget for Planned Parenthood. There's a line item for women's health services. And organizations put in bids to say we can provide this health service to cover this section in Alabama or this neighborhood in Chicago or this area of central Pennsylvania. And they get that bid and they provide those services for the course of the year. And the services that they provide, that the federal government helps pay for, are women's and men's health care, right? These are screenings for STDs, they're women's breast health examinations, well baby checkups, right? That many other organizations can provide. They're not bidding for them. So anyone who has an objection to Planned Parenthood, is free to start their own nonprofit and put in their own bid to do it for less money. Competition is always good. But the reality right now is that Planned Parenthood provides the majority of women's health services across the United States. For them to immediately be prohibited from putting in a bid to provide those services because they provide a service that is protected by law seems strange to me. But again, my work as guardian ad litem representing the children that come through the foster care system, I deal with women every day that don't have access to health care. We don't have a Planned Parenthood clinic in the 5th Congressional District. And some of these women struggle to find places that they can access health care. And it's part of my job to help them find that. So I want more resources for my clients and the parents of my clients to be able to access health care, not fewer. Thank you.